so many people tell me if you just find cancer in an early stage, but early is not necessarily good because some cancers, they never develop and they actually just disappear on their own. And beside the individual cost of living as a patient, well, it does require quite a lot of treatments. And just one story will make people say, well, shouldn't we just be saving one life? And then I have to be the big bad wolf saying, well, do you know what it costs?
Hello and welcome to the Sustainable Healthcare Podcast. I am Joachim from Green Innovation Group, and I have a really exciting episode for you today. I'm having a conversation with Alexandra Jønsson about overdiagnostics, overtreatment, and especially in this first episode around healthism and our culture of health. Alexandra is a researcher, a trained anthropologist, and we are talking about a lot of different interesting things centered around her new book. Soon we will all become patients, and at the core of it is this very, very interesting question or dilemma that not all of our treatment is working, and also that it is very, very hard as an individual to say no to treatment. And I find it especially interesting because she wrote the book together with a medical doctor, and so they have both of these perspectives. From the very data-driven, looking at the evidence, but she brings the human angle as well. Enjoy the episode. It was very interesting to do. Welcome to the podcast, Alexandra. It's so good to have you here.
Thank you.
I really looked forward to having this conversation with you. About our health culture, about sustainability, and that maybe we are sometimes actually doing too much in terms of health. But first of all, who are you and what made you interested in the health sector?
Well, I'm an anthropologist by training and I have a PhD in public health. And right now I'm currently working as an associate professor at Roskilde University. I think my interest into the healthcare section kind of began quite early on because I did a lot of work with patient organizations and I was interested in how life with chronic diseases might look like and how people would navigate and organize their everyday life.
But, is that all the way back to your anthropology studies?
That's all the way back, basically to my anthropology studies and my PhD as well, which was on kind of health inequity. I don't say inequality because I differ between those two. So it was about health inequity, how older people in more remote areas in Denmark living with multiple chronic diseases were basically getting less effect from the treatments they were dying prematurely, and they were worse off.
We have another episode to do. Health equity is big on our minds as well.
Yeah. But the thing is that the whole thing is actually quite well connected, because then I realized that the health inequity is also a lot about how do we allocate resources. So health inequity basically is also that we should have more resources allocated to the ones who need the most. More than 50 years ago, this famous doctor, Julian Tudor-Hart, wrote that in the Lancet, which he called the inverse care law, saying
one more time, please.
The inverse care law.
Yeah.
And basically it states that we give more healthcare to the people who need it the less, and less healthcare to the people who need it the most. And that's kind of got me interested in, so if all of these people suffering from various versions of health inequity, why aren't they getting the resources? And once you get to look into that, and I also did my PhD at the public health department, where my co-writer of the new upcoming book is a medical doctor and a professor. And we started looking into, well, maybe that's because so many resources are allocated to rich and healthy people. And I say that a little bit because I know rich and healthy people is, of course, a little provocative to say. But it is much about the preventing diseases among healthy people who doesn't really gain from it.
Could you, so what's the name of the book?
So the book is in Danish, Snart er vi alle patienter. And it's about overdiagnosis, but there is an English version in the working that is called Someday Soon We Will All Be Patients. And in that book, we're trying to say that so if these unfair and unjust allocations of resources are really making the healthy people stand out, what we're doing is that we're overusing resources.
And that's exactly why I wanted to have this conversation with you as well, because at Green Innovation Group, that's what we work with, making the healthcare sector sustainable. And at the core of that is spending the resources right, because the material, the CO2, the money that we're spending in the healthcare sector is just as real as in every other sector, but we are not really having that conversation, at least not in terms of climate and environment.
Exactly. I don't remember the exact numbers, but the healthcare sector is responsible for quite a large amount of...
It's around 4% of total CO2 emissions, so twice that of the flight industry.
Exactly. It's quite much. And isn't it funny to think about that when we then do talk about environmental issues and carbon emissions and all of that in terms of healthcare, what we talk about is the materials that are used. But just recently, the last couple of years, researchers have started looking into, well, what really would be gaining and would be minimizing the carbon emissions would be if we looked into the actions. So all of the treatments, all of the scans, all of the pictures, all of the machines, the housing, everything. And so this paper from March this year from a group of Australian researchers showed that 80% of the carbon emissions from healthcare comes from that, not the materials. So if we remain only speaking about, having reusable materials and all of that, if the conversation just stays there, we don't really get anywhere if we want to take this serious and have a healthcare system that is responsible and even, able to exist 30 years from now.
So that's one of the other key messages that we always have, that this is a huge problem now, but it's only going to get worse because we're going to get richer, especially in developing countries, and then we spend even more proportionally on healthcare, and we're also going to get older. And that also means an increased spending. So we really need to fix this. And we've talked about dividing, so we're going to do 2 episodes together, which is amazing. And this first one there's so much stuff in the book that it would be 20 episodes if we had to do it all. But the first one here, we're going to focus a little bit more on health culture and why that is linked to some of the overuse and sustainability challenges. And then in the second episode, we're going to talk more about the actual overuse and evidence-based medicine. So is it a fair sum up that one of the key points in the book is that, like you said, we are giving too much health, or at least too much healthcare to the wrong people? And part of that comes from our culture around health, at least in the West.
If you talk about us getting older, the positive side of that would be that we do get a lot of diseases, but those diseases would have been lethal, so you would have died from them just 20 or 30 years ago. But treatments have increased so much in effectiveness that you can actually...
That would be stuff like cancer and...
all of these kind of things, And that is always a positive story. So kind of raising the flag and saying, well, this does put enormous amount of pressure on the healthcare sector. It isn't always popular, but it's a conversation that we need to take. And the reason it isn't popular is what I call the health culture. And I think I need to state that I'm very much inspired by the concept of healthism, and that's not my concept. So many people are working with it, and my book is a textbook. So I'm basically drawing on other people's work as well. But healthism is basically describing the thing that health becomes this super value in society. So whatever
above everyone else,
above it trumps everything.
Yeah.
If we can save a life, then that's what matters.
Regardless of the cost, whether financial or environmental.
Or human costs. It seems like the conversation is also about getting to live as long as possible, but we're not asking, at least not many of us, what kind of lives do we have? So you might gain 10 years of lifespan, but if those 10 years are spent in a bed or in a nursing home, it's not really worth much. And then I know that my critics would say, well, that's why you need to keep in shape, you need to exercise, you need to eat a healthy diet. And I and a lot of other anthropologists will be yelling, no, this is not on the individual. This is about structures, and it's about, again, health becoming such a value that you can't really go against it. So we are somehow, in at least most of the socio-democratic societies, but also in some of the liberal societies, brought up to think that taking care of our own health is not only the responsible way of living, but it's also the moral obligation we have as citizens. Because we pay it back to society, so society won't be a burden to society. And it's easy to imagine then that if people have many diseases, well, then they become this burden to society. And nobody wants to be that. And that's why it's also so difficult. Now we spoke a little bit about health inequity, and that's why it's so difficult to identify and categorize people into subjects of health inequity, because nobody wants that term on them. It's mostly associated with some very negative stereotypes, but it goes for so many of us in society that there are just treatments that are not working well enough, unless you're high educated.
And it's kind of a double effect in the sense that, I mean, this is not my field of expertise, but to my understanding that it's both the people that needs it the most, because we know that socio-demographic stuff factor into this, that if you're purely educated or you're less wealthy, you will also have more of a lot of the diseases due to structural things, and you're more likely to smoke or be overweight and other stuff. And then what you're saying is that on top of that, you're also receiving less care actually, even though you are more in need.
Because the healthcare system is designed by people with high levels of education. And we have failed to be able to grab the people with lower educations.
So talk to me a bit more about this. So healthism is that it's healthcare is this super value, that it doesn't matter the cost as long as we improve the health, and that basically translate into our use of healthcare, because it's always a bad case to, like publicly or politically, to go out and say that maybe we shouldn't do this, or this treatment is not worth the effect. Or
You can't find any politician willing to withdraw some sort of treatment, even though researchers says this is not effective. It's just too unpopular. But as you say, the whole thing about healthism is that if you look at social media and newspapers, you see that so many headlines are centered around health in some way or another. New treatments, or you should be doing this to take care of yourself, and so on and so forth. But it sets up to us as a society that health is what is most important. And that also means that it gives less room for the critics, but it also gives less room for yourself to be critical about, should I really be getting this treatment? Because if you say no to a treatment, you have to explain why, and you somehow seem irresponsible. So my mom is like my favorite example, because she stopped going to her mammography screenings, not because of what I said, but
so
because...
So mammography, that would be for breast cancer?
Yes, exactly.
Yes, yeah.
And in Denmark, you're called in every other year if you're the age between 50 and 69.
Yeah.
And so my mom stopped, even though she's just in the middle of her 60s, because she once got a false positive, which is they're saying something is here, then they're saying, no, that was a mistake. But she got so scared.
Okay.
But what is interesting is that when she sits around with her friends, and my mom has a short educational background, and all of her friends have short educational backgrounds, and she does not dare tell them that she does not go to the mammography screenings, because it makes her look irresponsible, it makes her look silly and maybe stupid, and if you then does get cancer of any sort, they will think, well,
of course, you could have. That's on you.
Exactly. That's on you. And that's interesting because we also did an interview study with people with women who were older than 70. In the beginning, it was a questionnaire, and they filled it out. But then they had these unsolicited comments that they were furious. Why can't I get screening anymore? And the reason you don't get screening after 69 is that then screening has so little benefits, because the types of cancer that you get in high age will develop so slowly that we will catch them anyway.
With other methods,
Yeah. So
so there was also like a value being, or maybe even identity being given to taking the screenings, a bit like I do yoga, or I do walks with my dog. I'm a healthy, responsible person. That
exactly.
Would that be a fair?
That's definitely a fair description. And we found two really funny things about interviewing these women. So first off, they thought that going to screenings would prevent cancer. So they were saying, well, now that I don't get screened anymore, I will develop cancer. And then they were saying, that's because I don't matter to society anymore, because I'm an old woman now, and you don't care about me. All you care about as a young woman. Now I can get all the cancer that I want.
Now I feel like a person from Greenland being put on the ice flake, and you go take care of yourself. Yeah.
And beside that being completely wrong from a biomedical point of view, in an anthropological lens, it's interesting because it really resonates with that health culture and health as a super value. So. If you're not worth spending money on in healthcare, then you're nothing in society. And the whole thing about one's own responsibility.
Wow, I'm sensing an interesting tension here as well between overdiagnosing and overuse of healthcare and preventive healthcare as well. Because I mean that's one of the things that we're working a lot with our clients as well, is of course that many diseases or other things are easier and cheaper to fix if you catch them early on. Breast cancer being one of them. That's also...
See, that's not exactly true, though.
So I would definitely like to be challenged with this. So do you get the tension where I'm coming from? Like, that's the... also from a sustainability point of view, that would be the arguments for preventive healthcare, whether that would be exercise or early screenings or other things that it's
we need to talk.
Yes.
Because if you do early screening, the more screening you do, the more overdiagnosis do you find. Yes. Which means that you can't say on an individual level whether it's overdiagnosed or not. You can't say that until you do an autopsy. What do you call it? People are dying.
Yeah, when you cut them up after they die.
Yeah.
So what does it mean that it's overdiagnosed?
It means that cancer is not just cancer. So usually when I speak to people that are not doctors, I would say let's say there are 4 types of cancers. So there's the bird cancer, and within breast cancer, for instance, there's the bird cancer that will just, it's so free and will fly, so we can't catch it anyway, and we won't catch it in screening. And then there's the beer cancer, which is the dangerous one, and you may catch that in screening, and you may find it still from symptoms. And then you have the 2 more interesting things. You have the turtle cancer, which is so slow that even though it develops, you will never have any symptoms.
They represent the speed of the cancer spreading.
Yes. And the turtle would be the slow one.
That's very friendly for non-doctors like me to understand.
But maybe it's not so friendly to tell you that you will have probably between 4 and 5 turtle cancers in your body right now.
All right, even though I'm in my mid-30s.
Yes.
Yeah, okay.
And you will never get to develop any symptoms from them, and you will never die from them. So my question to you would be, well, then do you think we should scan for them? Do you think that we and screen for them? Do you
Or
think
treat them, yeah.
and treat them?
Yeah.
Because that is really costly, not just in money, but also in carbon emissions. And going back to the major carbon emissions coming from the treatments. But your story is so much easier to tell because of that health culture. It's much easier to be you saying that we should be preventive. We should take diseases before they develop. And it's much more difficult to be me because it's quite difficult to grasp and understand when it goes against everything that you thought you know. So many people tell me if you just find cancer in an early stage, but early is not necessarily good because some cancers, they never develop and they actually just disappear on their own. And finding a cancer, say, this year, and then treating it through a cancer program, and then 10 years from that on, that person would have been given symptoms, and then we could have been treating it. Then you have 10 years where you live as a patient. And beside the individual cost of living as a patient, well, it does require quite a lot of treatments. And the problem with detecting these diseases is, as I told you, we can't say it on an individual level. So we have to make some decisions regarding sustainable healthcare that is on a population basis, and those are not very popular.
No.
And particularly not because we're all brought up with, you need to be responsible, you need to take care of
so
your health.
that's also back to the healthism, with both that healthcare is an absolute value, but also our individualism that we want decisions, whether we like the decisions or not, we want them to be made on me as a basis. And I don't want to just know that, well, statistics says this, so this is what we are going to do, even though, because we can't really say it for you for sure.
And I always run into what I call the popularity paradox, because you will probably, when we turn off the camera, tell me, well, my mom's sister, she actually found their cancer in a screening program and she was safe from it. And I can never prove you wrong. I can say, well, yes, they found a cancer, yes, you were treated, but we will never know if that cancer has developed. And just one story will make people say, well, shouldn't we just be saving one life? And then I have to be the big bad wolf saying, well, do you know what it costs? And we need to have that ethical conversation. And I don't want to take part of that. I'm a researcher, so I just want to pull out theories and facts, and then politicians can make their decisions. And if they make decisions that I disagree with, well, we live in a democracy.
Yeah, it's a hard. I mean, it's a bit like softer punishment for criminals, where all the evidence is there that longer sentences don't reduce crime past a certain point. But that's just a losing case. You're never going to get a politician to go out and say that. That's
actually exactly the same. Thank you for bringing that up. But again, that would be an easier story to tell than me saying, well, you know what, cancer is not just cancer and you don't have to screen for that. Because then there's also the last thing, that basically we're all afraid of dying.
Yeah, of course.
And we have this idea that the more we know, the more we can do about it. But the thing is that you can't take knowledge back. You can't take information back. So people doing a test for genetics, for instance, will maybe be told, what if I told you that you have 22 more percentage risk of dying from a heart attack than an average person your age? How to do that? I can't do anything about it. I can tell you, as I would before, you need to exercise, you need to eat healthy and stop smoking. Which brings me back to, if we really want to take preventive healthcare, cigarettes would be the most effective way if we could make people stop smoking.
Oh yeah, definitely.
Yeah, that would help us in so many ways.
And that's actually, it's very interesting from an environmental point of view as well, because it's just like multiple bad. It makes people sicker for some very expensive treatments. Cigarette butts are one of the most thrown out forms of trash, and has all kinds of plastic shit in them all around. And you're also putting out smoke, and also the way that tobacco is grown in monoculture is not done. So it's just bad upon bad upon bad. what I hear you saying and what I agree with is that we have this mega trend as well of maybe connected to healthism, that we want to know everything and we want to take extreme control on our whole health with genetic diagnosis, and also, I mean, if you're pregnant and having a baby, then you get to know a lot more, but do you really? One of the things a classic mistake I see people make is that, well, you have a 50% increased risk of this. That sounds like a lot. Like, okay, now it's going to happen. I mean, it's a coin toss. But I mean, if it's 1 out of 100,000 and it increases, like now it's 1.5 out of 100,000.
Yeah. So in statistics, we would definitely differ. Is it relative risk or is it absolute risk?
But I just see that mistake being made all the time in news articles. But what I was getting at here as well, and which I've studied philosophy amongst other things, so it's like we are reluctant to accept that we're just human, and that there are limits, and even with all this technology that we get, that there are limits to what we can actually do. Is that something that you're seeing as well, that we're putting too much faith in some technological developments?
Definitely, and I see it in parents and patients and relatives pushing that we should do more, or we should know about more, or stories being told that, isn't it unfair that my daughter died from this disease, that maybe I saw an influencer talking about her daughter dying from breast cancer. It was horrible. Tragically, I wish we could do something about breast cancer, brain cancer, but the thing is that she made it into a moral question. She says, how can we offer these kids no better treatments? And that's quite a lay experience of what can medical and technology actually offer in terms of treatments. And I think that's because I'm a human too, and I don't want to die, and I don't want to be sick, and I don't want my kids or my relatives to die. But we have to face that we can't prevent death, and we can't prevent all sorts of diseases.
There's a lot of billionaires who are really trying to prove that wrong, but I'm more on your side. I don't think.
Well, you know, if they prove it, I'm always up for changing my opinion. I'm a researcher, so if they can make me smarter, but let's see about that. Yeah. No, I think it's the problem is going back to again that we're all afraid of dying. Then it's counterintuitive being told that, well, you shouldn't be taking these genetic tests. So we see a lot of people going to primary care, to the general practitioner, and saying, I would like to have a general health check. And now the Danish National Board of Health do not recommend health checks, and that's because we made a very, very well done study in Denmark. And all of the best medical evidence along with that study shows that there are no effects on mortality or on morbidity, meaning that people will not live longer or have less diseases if they have a general health checkup, even though we do them consecutively, and even though we have conversations about diet and exercise and so on and so forth. That's
also contrarian to the popular disease, especially for males, that males, they die faster because they don't go to the doctor.
Exactly, and then you see some wife putting their 60-year-old male to the doctor as saying, I want a 50 kilometers checkup, like I do for my car. And then you have the doctor saying, well, you know what, your body is not a car. First off, your body can repair itself, the car can't. And second, it's way more complicated. So I can do all of these tests. I have a doctor telling me this great analogies. He's saying that I can do all of these tests, but still it's like looking at a picture through a toilet paper roll. I can only see this. I cannot guarantee you that there are any diseases right next to it. But again, what you're saying here is mentioning the stories about our health. And I am also being not very popular for saying this, but there's a reason that women go more to doctors than men. And many of the studies forget to incorporate in their statistics and the results that female are the ones to see their doctors for reproduction, for preservatives. Most of them still, despite it being 2022, are the ones taking the kids for their vaccinations and for their doctor's visits. and then you get registered as the one coming. So that might explain some of the difference.
Yeah, that makes a lot of sense.
Yeah, but of course not all of it. But then again, I ask, well, do men with high educational background go more often to the doctor than males with low educational backgrounds? Not necessarily, because they are quite sick, the males with the low educational background. So they will go for regular checkups for their diabetes or their cholesterol or whatever. So that's a perfect example of taking something very complex into a very simple analogy, placing it back and say, hey males, you should go see your doctor.
Yeah. It's all the way back to the evidence. I think we should talk a lot more about that in the next episode. So if we had to wrap it all up, healthism is a thing. The fact that health is a super value that sort of trumps everything else, and that combined with our individual feeling of responsibility, what it means to be a good citizen, to take care of your own health, means that we basically never decline any health options, and it's a losing case for any politician or hospital director to go out and say, hey, we should actually do less of these things. And that is despite there being quite good evidence for a number of screenings or treatments and other things that we're doing which actually don't have the effect that it needs to. And
Yes.
And then maybe we can talk more about that in the next episode. That also means that there's not enough resources in the healthcare system, and that hurts the ones that needs it the most.
Exactly. And
wow, that was a long
thing,
time.
well, that was a very good sound up, or what do you call it? But the problem is that this is part of our culture, and culture is not something that you change overnight.
That was exactly my follow-up question. So, and you might pull the boring I'm a researcher card, but what should we do to culturally? We can talk more about overdiagnosing later.
Well, I don't know if you watched the show that's called Dope Sick on HBO, but that show
no,
actually...
but I've seen it, yeah.
Yeah.
It's about the opiate epidemic.
Yeah, and it made a conversation among lay people and in the public about medical firms.
Yeah.
They're not like that in Denmark necessarily, but some of the American medical firms are quite nasty when it comes to finding ways of selling products. So my thing would be that culture is always developing. It's never just like standing still. But if we want our health culture to develop into a more sustainable future, maybe we need art, because my research is quite difficult to comprehend. But if it's told through a story that you can actually understand, maybe more people will be aware.
So you should get a movie deal on the book. Yeah.
Yes, I should. Well, you know what? Doing a podcast is first step.
It's so good to have you here. And I think you should really plug the book again. So if you could say the title and where to get it. And,
it's called...
Why you should read it.
Snart er vi alle patienter. Overdiagnostik i medicinske og samfundsfaglige perspektiver. It's coming out on samfundslitteratur, and we won the biggest textbook prize in Denmark.
Wow.
For it. So and you get that for an
even
idea.
Even before
you get it
published?
for the synopsis.
Okay.
Yes.
Yeah.
So we got that prize back in 2019, and since we have to update the book with evidence and theories and everything, it's.
And it's written by you, an anthropologist, and a medical doctor, sort of.
Yes.
Cover both of these worlds. Yeah.
So medical doctor, I think anybody who are interested in the healthcare sector would gain from reading it, because it's a textbook, so it draws upon a lot of research that's already been done, and we have made a huge pedagogical work trying to make it accessible. So my anthropologist fellows would not as easily understand the more statistical points of the book, just as well as my medical doctor colleagues are kind of
so you don't need to know Foucault to go through it. And,
no, I do mention Foucault, but I'm not a big fan of Foucauldian theory. It's
Me neither, but I think it's sort of a union thing on anthropology that you kind of have to do it somewhere.
It probably is. Yeah. And well, the book will provide you with the evidence that I'm talking about. It will provide you with some theories suggesting how to understand that, including healthism, and then you can make up your own mind.
Well, I've one. I'm going to buy one.
Glad to.
Yeah. All right. Is there any place people should follow you on social media or other things?
People can always write me an email.
Yeah.
And I am on Twitter and I am on Instagram, and I promised my publishers that now I will be more active. I am an older lady. I do not.
Here you are in a podcast promoting the book. Well done. Thank you so much for coming, Alexandra. That was a wonderful conversation.
Thank you for having me.
Thank you so much for listening. It was really a joy to do the episode, and I hope you enjoyed listening to it. I could talk for hours with Alexandra, and we actually ended up doing so. So there's another episode coming where we focus even more on overdiagnosing and over treatment. So you can look forward to that episode. If you're interested in what else we're doing, go check out greeninnovationgroup.com. We are management consultants for the healthcare industry, and privileged to have the pleasure of working with some of the largest pharmaceutical and medtech companies in the world. Thanks for listening in, and enjoy your day.